Hi everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to continue talking about visual rehabilitation. We're going to go over how to assess saccades. Now, if you haven't watched my other video on visual rehabilitation concepts, I'd encourage you to take a look. It'll give you more insight before watching this video. I'm going to be splitting up videos on how to assess saccades as well as some treatment options. I think it's just going to be easier to digest. So remember, the definition of a saccade is for one or both eyes to be able to jump between targets or from one target to another perfectly without any corrective saccades. So this is particularly important for us because it's very functional. We actually use saccades when we are reading. My personal preference is to use 2 popsicle sticks as my target sticks. I'll put a small red dot on the end of one stick and a small blue dot on the end of the other stick. Now you can use other items, these are just what I usually use. It's also okay to use a larger target if somebody has impaired acuity. And remember, we want to be doing this with a bare background behind us. We don't want it to be very distracting. Now, I usually sit in front of the person, I take my target sticks, and for reading, I'm going to hold them about 8 inches apart, so about the width of my face, maybe slightly wider. And I'm going to make sure that my sticks are about 16 inches in front of their face. This is for reading. Now, for concussion management, some people will be using it with 3 feet of distance in front of them. My preference is to first assess one eye at a time and then both eyes together. And we do want to go over horizontal saccades, vertical, and diagonal. I usually don't mention to keep their head still. I want to see what they naturally do. I just tell them when I say red, you look at the red dot. When I say blue, look at the blue dot, but don't look until I tell you to. And I normally have them go back and forth about 5 round trips. I'm going to do a quick demonstration on how you would assess saccades with the popsicle sticks. So I'd be sitting in front of them at the right distance. I can hold my 2 popsicle sticks. Now here I just have one with a red dot and a black dot. I can't find the one with my blue dot, so we're just going to use this. I'm going to hold it about 8 inches apart and about 16 inches in front of their face. So what I tell them is today we're going to be looking at the ability of your eyes to jump from one target to another. Now cover one eye, and with the other eye, you're going to jump from the red target to the black target, but when I say to. So if I say red, you're going to jump to the red target. And if I say black, you're going to jump to the black target. Okay? Red, black, red, black, red, black, red, black, red, black. And then after I do with that eye closed, I would switch to the other side. I can also do vertical. So again, don't jump to the red or black target until I tell you to. Red, black, red, black, red, black, red, black. Okay, and then I can also do it diagonal. Okay, all right, and that's a demonstration of what I typically do when I'm assessing saccades. What I'm looking for is if I see any dysmetric saccades. So dysmetric means that it's uncoordinated and it's either hypermetric, which is overshooting, or hypometric, which is undershooting. What you'll usually see if it overshoots is they'll pass the target and then they'll correct back. Or if they undershoot, they won't get quite to the target and then they'll correct to the target. Now, normally we would have no corrective saccades or maybe one very slight, tiny corrective saccade. If it's noticeable, it's probably not normal. There are formal ways to grade this, depending on the number of trips that they can perform, the accuracy of their saccades, as well as any head and body movement. But normally I just look for if it's dysmetric and if there are any corrective saccades. All right, so that's a really short video. That's how we assess saccades and I'll make another video on treatment options if you find saccades are impaired. I hope you enjoyed the video. If you did, like and subscribe. See you next time.